thank you for inviting me to present our studies on school closure during the pandemic period. And yeah, I'm very pleased to be here because it was also a very exciting Congress. So thank you very much for all the presentation also. So let's start with our studies. First of all, this is the outline of our presentation. So I'm going to start presenting the results of our Italian national observational study carried out during the second wave in 2020. Then a meta-analysis of SARS-CoV-2 infection in schools. The analysis that we carried out looking at trends of SARS-CoV-2 incidence in Italy, Germany, and Portugal, with school opening during the Omicron wave. This was within the consortium of EUCARE study that was presented also yesterday. And then other publication, comparison with other results of our publication, assessing the role of school closure and reopening. So let's start with our Italian National Observational School Study. So as a background, I wanted to remember that Italy was the first country that started lockdown and have very stringent measures since the beginning of the pandemic, and they were kept for a long time. In particular, school closure was the first measure taken in place. And we had a record for school closure, in particular for primary school. They were closed since very early the pandemic, and then they reopened, at least for some region, a few weeks in September, and they were closed again for a long time. So that's why we collected all the available data. So from September to November 2020, we have data on SARS-CoV-2 incidence in school for 7 million students, 700 teachers, 700,000 teachers and non-teaching staff, so 19% of Italian schools. So from November to beginning of December, we have all the data regarding swabs and secondary infection for about 50% of the Italian institutes. And in December, we have also data on secondary infection by type of index case in school of a Veneto region that was one of the regions that more invested in contact tracing. So we have data from the school principals every week for each comprehensive institute, data from the National Health System responsible for contact tracing, and also data from the Italian Civil Protection and Office for the National Statistics. So we first analyzed the incidence in schools, in teachers and students compared to the general population. And here you can see the incidence in elementary and middle school students compared to the general population. And in average, we found 39% lower incidence compared to the general population, except for Lazio, is a little region that was similar, but the vast majority much lower incidence. For high school, the situation is more similar to the general population, in average 9%, but it was more or less similar, except for a region market that invested a lot in screening in schools. But for teachers, the situation was different. For teachers and non-teaching staff, we have a twofold higher incidence than in the general population. So we investigated the reason for these differences. And actually, the number of swabs for screening per week during contact tracing after an index case was found was really very high. Arrived to 50, 100, even more every time for students and teachers, so similar to what was done in hospitals. We also investigated the frequency of secondary cases in teachers at school by type of index case. And actually, we found a significantly higher infections in teachers when the index case was a teacher. So the transmission was mainly from a teacher to a teacher. And also similar results were found in a study conducted in Georgia where investigated the sources of the infection, the index case. Then we investigated the changes in time of SARS-CoV-2 in association with opening and closing of schools. So what we have done, it was not an analysis at a national level, but we consider a matching comparison region by region, considering the region that were similar for density of the population, for geographical area, and considering because in Italy they open in different time period, in different weeks, so we compare the regions that open before the second region, so to see if there was a lag time, a difference in RT, and we didn't find any association of the changes in the RT and any association with opening or closing of schools. Here we have the RT, we have the first derivative of the RT, and I mentioned Campania because it was one of the countries that closed for longer time the schools, in particular for the primary schools. And here, as you can see, they closed very early. And even if we don't have data for incidence for children because they stopped as soon as the school was closed, the curves continue to increase without any change. And I want to mention that even the New York Times at a certain point wrote an article about regarding Campania, mentioning that a country like Italy, especially the south of Italy, we have a problem with students that they don't return to schools, and it was really they kept the school very for a long time, very closed for a very long time. So we also try to investigate the changes of the curves by age. And actually, we found that the first group of age, the first cohort that really increased the number of cases was the young adult, so between 20 and 35. It was the first group, the first cohort that started to increase the number of cases, followed by the adult, so 35 to 59 years, where the younger were the last. The youngest. So all this analysis were published in the Lancet Regional Health. The publication arrived early in 2021, and fortunately it was taken into account from the government that in April, at the end, mentioning this study, open schools. And so we were very happy. And also the WHO considered this study. They organized a group to talk about the issue regarding school closure, and so pushing the countries to take into account the importance of keeping school closure. And they mentioned only one study, our study, saying that the frequency of infection in school was very rare. So we were very proud. But obviously, in our country, we were much more criticized by media mainstream, but not only by them. A group of scientists brought to the Lancet to ask to retract our study. And they were very aggressive, in particular against myself. And the Lancet asked us to write an article regarding sexism and harassment in academia. And I didn't write that article, but we continued to study, and we carried out a meta-analysis. So what we have done was to collect all the information regarding all the studies that were carried out everywhere from 2000 to 2021. From screening schools, we show that actually overall the percentages of positive cases was 0.44. High variability, but very low overall. So screening without symptoms, when they do screening without looking at symptoms. Yes. And then we did also meta-analysis of serological test to see if there was an infection independently of symptoms. So what was the percentage of infection, and also comparing, again, students versus teachers. And again, we found similar results. So 40% reduced susceptibility of students versus teachers. And also we compared the infectivity, again confirming that 74% reduced infectivity in students versus teachers. So very consistent results. So we continue also to analyze the data regarding trends, and we compare this time Italy, Germany, and Portugal within the framework of EU care study during the Omicron wave. For the Omicron wave, at that time, we didn't have many other measures that were taken, were used for in schools at least. We didn't have a lockdown. But we were able to investigate the role of school closure. And here, indicated in square, in blue, you see the period in Italy and in Germany where the schools were opening, because different regions and different states open schools in different time period. And we did analysis by age, consider different also subgroup analysis with different age groups. And so we applied the staggered difference in differences analysis to investigate a causal association. And as you can see, we found a decreased number of cases comparing the states and the regions that open compared to the one that didn't open. So we were able to estimate the effect of school opening by length of exposure. And as you can see, we found a significant, at least for young students, a significant decrease with school opening. And the similar results were found in Germany, even worse, even a higher decrease in number of cases, both in the young and the older group with the school opening. We applied a different method for the data in Portugal, because for Portugal we have only one date of school opening for all the country. So we applied a stain effect for the cohort, comparing the counterfactual and the sustained effect, and we found for intermittent cohort analysis, and we found a decrease, again, similar methods, similar result to what we have found for the previous analysis. So significant decrease after school opening. So what other people have found? I mentioned this study because they have carried out a similar analysis to what we have done. So they matched municipality, the one with that open schools compared to the one that didn't open, taking into account of the possible confounding factors, density of the population, other factors, and they found similar results to what, so they were able to do, like we have done, a very high granular level, the analysis. And the title is, there is no doubt, no causal effect of school closure in Japan in spring 2020. But there have been several other publications, and there was also a systematic review in BNJ Open, and they evaluated all the studies that presented quantitative estimates of the impact school closure on community. And it was interesting because they analyzed the results based on the quality of the studies, if they were able to take into account of confounders and so on. And they showed that the study with lower risk of bias didn't report any association, while those with a higher risk of bias generally reported a significant preventive effect of school closure. We also carried out a meta-analysis of serological tests, because this was one of the measures considered by our government when the school reopened. And actually, we found that the specificity and sensitivity were generally very high of all the methods, but this is not sufficient for screening the general population in areas when we have low prevalence of SARS-CoV-2, such as school. And so a positive predictive value of between 76 and 88% with a prevalence of 5%, for example, means that about at least 1 in 5 results would be a false positive case. It was published in New England Journal of Medicine in February 2021, one important study by researcher in Sweden. You know, Sweden was one of the countries that kept school open almost all period, just for secondary school, high school, they closed for a short period. And they showed that the risk of severe COVID-19, intensive care COVID-19 in teachers, they were worried about that, of course. You know, Sweden was very attacked for this choice. And they showed that the risk was lower compared with other occupations, excluding healthcare worker. But also another publication came out in September 2021. Again, it was an important study because it was in BMJ, a national Scottish study, and they found similar results. So teachers and their households were at lower risk of severe COVID-19 compared to other occupations, considering also healthcare workers. So, in conclusion, no clear evidence that school openings are causally associated with an increased transmission in SARS-CoV-2, both in the young population and the general population in Italy during the second wave. But also consistent results across 3 different countries, so Italy, Germany, and Portugal, during the Omicron wave, indicated no association with school opening. And also multivariable model adjusted for confounders did not change the results. So the trends of SARS-CoV-2 curves appear to be driven more by other factors, such as geographical location, or overall population behavior, maybe summertime, more infection, than by school opening. So the highest rates of infection and infectivity were found among teachers, although no more severe case of COVID-19 were observed compared to other occupations. So being positive to a test doesn't mean to have a disease. And given the uncertain evidence on transmission and the well-known psychological harm of closure, the precautionary principle should have supported reopening school during the second wave. So I want to thank all the group, the care group, but in particular Federica Bellerva and Giulia Doi. They presented also the result yesterday, and they were the statistician of this group. So thank you very much all for the listening.